Yep.
Okay, I will call the Winnebago County Community Mental Health Board meeting to order Wednesday, December 6, 2023, and the time is 2 p.m. I want to welcome our visitors, and at this time I'll take roll call. Mary Ann Abadi present, Dr. Copeland,
Present.
Dr. Giardini,
Present.
Dr. Gorski,
Present.
Dick Hunter,
Here.
Wendy Larson-Bennett, Tim Neighbors, Linda Sandquist, Mohammed Yunus,
Yeah.
and Jason Holcomb, and Chelsea Glantz, and Nicole Bennett. So I'm gonna just welcome everyone. We have a public comment today by Harlan Johnson, and he did pass out his comments, so I don't know if everybody got them. Harlan, if you can use the podium or stand, whatever you want to do, and it's 3 minutes, and we don't comment at this point after, so, okay, thank
You want
you,
my card so anyone can call me and follow.
thank you.
And if anybody is interested in the NAACP Freedom Banquet, it's this Sunday, it's 5 o'clock, and tickets are $100.
Okay, you might want to speak a little louder, just so that people on YouTube can
And
hear.
if you have a hard, oh, okay, yeah, and they can't read this, so.
Yeah, so it's important.
I would like to meet with one or more members of the board regarding 2 issues. First is a philosophy of life I've introduced to hundreds of people during my 50 years as a therapist. It's a way of organizing human relationships that most people are not aware of. A philosophy I call community rather than competition. It's very different from the philosophy of might makes right, also called domination structures, which is almost universal in our world. Community rather than competition, in other words, power with rather than power over, was popularized by Marshall Rosenberg many years ago when he published a book named for his strategy for creating this community rather than competition. Nonviolent communication, a language of life. NVC, for short, that's what I use when I talk about it. When I introduce NVC to people who come to me and they learn and use it, many no longer need therapy. They're happy. Their relationships are transformed in wonderful ways. They can describe NVC, I can describe NVC in a minute, and yet it takes a lifetime to make it a second nature to you. I'd like to introduce NVC to those who meet with me and show them a 10-minute video that I created based on Rosenberg's book, Practical Spirituality. I believe that when the board learns more about NVC, it will result in greater mental health in our region, less mental illness. The second thing I hope to meet with board members about is the need for all the specialists in behavioral health to be connected so we can accomplish more to increase mental health and reduce mental illness in our region. We need a strategy for all those who specialize in behavioral health to communicate, to recognize each other as partners. We're all part of an effort to enhance mental well-being for everyone. I'm talking about psychiatrists, psychologists, social workers, mental health counselors, marriage and family therapists, school counselors, life coaches, clergy, addiction counselors, etc., many other specialties. And we've been in silos for so long. We need to come together for everyone's benefit.
Thank you very much.
And the back of this sheet elaborates on what I've got.
Okay, thanks very much. Appreciate it.
Thank you.
We don't have any presentations today. Our monthly activity report, and Jason, I'll let you highlight.
Sure, we actually have had a lot going on, and a couple things I'd like to highlight over the last month, in addition to just getting our grant program launched, which I'll say, as of yesterday, everything is up and live, all the portals for accelerator, renewal applications, new applications. We had a recorded kind of grant seekers information session that's been posted on YouTube. And we had our first question and answer session yesterday, and that was really quite good. We had a lot of great conversation, good questions. Definitely, you can kind of tell as the years go on that our program has become a little more sophisticated because the kind of questions we get are a little more pointed and so it was good. And we have a second one scheduled for Thursday of next week, fielding a lot of questions between those open sessions and emails from some of these organizations that are looking for funding. One other thing I'll just quickly mention is that Chelsea and I had the opportunity through kind of some planning council connections to go to Kansas City for just a quick 2-day trip and visit their equivalent of a planning council there, which is much larger than ours. They're trying to organize multiple counties over 2 state, bordered region. And that planning council there is working on, they won a grant from SAMHSA, and they're trying to do 911 and 988 integration.
Oh, boy.
And so they were a very kind host and scheduled multiple meetings for us to meet with some of their law enforcement, got to visit one of their 911 centers where they're actually gonna have 988 operators in the 911 center that was on their Kansas side. Their Missouri side's completely different because in their Missouri side, all the 988 people are work from home. On the Kansas side, they're all in person. So 2 different models, and they're working across all of that complexity. So it's really good information. I don't know that everything is directly implementable here, but it was good things for us to think about as we're navigating this space. And I sit on the regional CESA committee through the state for our area. So it's information I can share there as well as they're trying to navigate how to really move forward with some of that state legislation. So just wanted to mention that. And you'll see we had a long list of activities this week, so this past month, so I won't speak to each component of that.
Okay, one question that I have for you, have they implemented 988 where it's just the mental health worker going out?
Yes.
Okay.
Yeah.
Alrighty. That would be interesting.
Mental health, well, in Illinois, it's mental health worker plus a peer recovery support specialist, which is a person with lived experience with a certificate in mental health plus a licensed clinician.
With the,
That's the model.
Right.
Mobile crisis response.
and then is there a tie-in to the police if need be?
If need be. Yeah.
Okay. Alrighty. Moving on to our action items, I need a motion to approve the November 2023 meeting.
So moved.
Okay, second, all right. We can do this by just,
Yeah.
okay, any comments, any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Opposed, same sign. Okay, the minutes have been approved for November 23. Then we are next to the resolution, number 2023, resolution authorizing funded program budgets, updates for program year 23-24. So Jason, do you want to?
Yeah, I'll just give a brief summary and then we do have staff from the program here available to answer questions if you have any, but essentially there was originally budgeted dollars for fringe benefits, insurance and fringe benefits for the new hired staff. And when they actually hired that position, they were not required to pay the fringe benefits as part of the employment through NIU is my understanding. And so that just created a budget surplus that's being reallocated into some other line items to support the programming.
Okay, any comments or questions or discussion on this?
How many were hired? Just one? Okay.
So you need a motion.
I need a motion.
I move then that the resolution be entered to allow Nikki to make the changes that they are necessary.
Okay. Thank you, Dr. Gorski. All right, any further discussion? Hearing none. This is money. So I will do roll call. Dr. Copeland?
Aye.
Dr. Giardini?
Aye.
Dr. Gorski.
Aye.
Dick Corner.
Aye.
Wendy Larson Bennett, Tim Neighbors, Linda Sandquist, Mohammed Yunus.
Aye.
And Mary Ann Abadi, aye. All right. And we are moving into our discussion items. And the first one is our Accelerator Award and Core Program Grant Reviews. And Jason, do you want to summarize for us?
I'm gonna let Nicole take that, actually.
Okay.
And I've got a PowerPoint, so just put this up and maybe I'll do a screen share so anyone watching can see it. Just give me 1 second to get that ready. Harlan Johnson once told me that our meetings were the most inclusive public meetings in the area, so I'm gonna continue in that spirit with putting our PowerPoint on the YouTube page for everyone to see. Okay.
Okay, so just today wanted to kind of talk about what the next few months, the timeline for grant reviews are. So announcements will be the board meeting in April, so April 3rd. So a lot of work to be done between now and then. So for Accelerator Awards, there's not necessarily a timeline. So December 1st, the interest and funding form was available on the website. So once organizations complete that, that'll be reviewed and then brought to board for full vote. So once an application is received, there could be applications that are ready for review and ready for board vote. They could be ineligible, so there's certain criteria to make somebody eligible for Accelerator Awards. Or follow-up. So you could request an organization to come and give you a presentation. You could maybe just need additional information that I could obtain or we could obtain via email. But when they're all ready for review, they will come here as a final vote. So we'll have a rubric for everybody to review together and vote. So does anybody have questions about the timeline? We anticipate to have some reviews in January, so the January board meeting. We have had a lot of interest. There's been a lot of email questions, a lot of questions on our Q&A session about the Accelerator Award. So we are anticipating those. But as you all know, it's first come, first serve. So we're making sure to track whenever we receive them to make sure that everybody is reviewed in a timely fashion. So for the next slide, I want to talk about abstracts. So the grant portal is open for abstracts, so for anybody like we did last year to fill out a brief application, that way they're not spending a lot of time on ideas, but being able to pitch their idea to you. So abstracts are due January 5th for grantees, and then from January 8th to the 24th is when the board would evaluate. So 3-week turnaround, but these, remember, are very abbreviated, very short abstracts. And so from those evaluations on February 7th is when the board would announce which abstracts you would like to move to full applications. And there's a 3-week turnaround as well for organizations for those. And then the board would have about 3 weeks as well to evaluate, and then that April 3rd turnaround. So in our conversations, there's one more too, and then we can. So continued funding, so that kind of third funding. So anybody that has been funded for 1 or more years is eligible for continued funding, but they have to have been, well, there's nobody that's not, never mind. So the deadline for those are February 7th, so the portal is open for grantees as of now. And there's a little bit longer, almost a month for the board to evaluate those, but then the same deadline of April 3rd. So what we wanted to talk about today is, given the timelines that we've said, kind of, February to March, and then Jason, sorry, if you could go backwards.
Yep, there was,
Yeah, so during the 3 weeks of January, and then there's the end of February to beginning of March. So if people know that they have availability and would be interested in reviewing, if people are like, this is my favorite thing I've ever done is review grants, and you want to sign up, absolutely excited to have you. But if you're like, I know I will be out of town and that's going to be a struggle for me, that's fine. You don't have to decide today. You can email us or call us and let us know who is interested, so then we can, yes, sir.
So my question is, what are your estimates of the accelerator applications? Because that will be a time factor along with this.
Yes, but the unique part about those is you'll review those here. So you'll review those in your open meeting, so you won't have to do any work ahead of time. You'll collectively share that responsibility, so whoever is here, and we'll get information to you ahead of time so you can review before the meeting. But those will be kind of, go ahead.
No, the scoring rubric, I mean, will that be applicable to the accelerator grants?
Yep, so and I can get you a copy of it. The accelerator rubric matches the application exactly. So whatever the grantees were asked to fill out, you rate that. And some of the rubrics, we tried to make more streamlined, so more comprehensive than before. Same thing for the abstracts and the continued applications, they all match the applications exactly. Mohammed last year identified that there were some sections that didn't all the way match up, so we made sure that that was adjusted this year. And so, yeah, so we have the accelerator awards are the only ones that you're gonna do in an open meeting and that you'll kind of do by hand. But there's a process in Foundant where we can add your comments at a later date. But all of the other ones will be the standard, going through, selecting, but they're much more abbreviated than in previous years. And there's a lot more space for you to add your qualitative analysis instead of just scoring. So there's both components, but we can get emailed versions to everybody so they can see them ahead of time if people are interested in that.
So kind of the simplified version of it is that we need some board members who are available in January.
Yeah.
We need some board members who are available in February. We need some board members who are available in March to do reviews. Our funding policy has adjusted over time. We do not require a certain threshold number of board reviewers, but we do want those board feedback and comments. So please, if you know it right now and you want to tell us which ones you're available for, but we just want to make sure it really matches up with your availability so that when we get to that deadline, because we're moving through it fast, not that we don't love tracking you down, but we don't want to have to, the last day it's due, try to get you through 10, quickly. So think about,
Track our phones.
think about when you really have availability, because we've got it tiered where it's going to be January, February, March, 3 different review stages.
If I could, Marion, I know Nicole said that the process would be more streamlined. I'm thinking in particular the continued funding. And I know we've talked about this before, and I apologize, I simply can't understand or remember where we landed on it. But we've talked a bit, I think, about the staff being more active in those at checking the boxes for us. So in other words, outcomes reporting, yes. Fidelity to budget, yes. I mean, rather than us hunting and pecking for it on our own. I can't remember if we came to a comfort level with
Well,
that.
they generally do that.
Yeah, so we are doing that again this year, the grant summaries. So feedback that you guys have provided since last grant cycle to forward, we've kept track of. So to make sure whatever outcomes program set, to tell you what those were and what they did accomplish. Same thing with their budget utilization, so you know what percentage. And you have to remember that it's only gonna be half of the program year, but you'll also have the first year they've received funding, for example, the second year, now the year or half of a year. So you'll have a lot of information, but organized in a way that is outcomes, finance, staffing, so you can know if programs are fully staffed.
I do recall all that, having done that. What I'm getting at is the board, are we mature enough now for staff to offer their opinions, not the right word, their analysis of that? Because over time, you have observed these. For us to go and look at, say, a multi-year, someone who has a multi-year thing and say, well, their outcomes are tracking in the right direction. We have to, in my having done them, it seems to me we have to do a lot of looking for that to make a judgment about it. Where you guys have the full picture, you see the whole thing and you go, yeah, if you look at this one particular thing, it may not stand on its own as an outcome, but we tracked it over time and they're moving in the right direction. I don't know if anybody else sees.
Yeah, I
But it's just, my opinion is that.
Are they doing what they said they were going to do?
Are they doing what they said they were gonna do in the time frame in which we would expect it? Yes, there are some delays, but in our judgment, they are moving in the right direction. I don't know if we consider ourselves mature enough or that we feel that with staff, that's something that's appropriate to ask them to do or not. But getting to your point about reviewing them, of course, I'll want to review them, but it gets to the numbers of them and how much time do we spend at each one, and I've gotten better over the years, it's taking an hour each one.
Yeah.
And if there's 30 of them, that might be tough for me to do, so.
I mean, I really appreciate the accountability that ties back to public officials having the decision-making authority and really being the ones making their recommendations, even if it takes a little extra going through the weeds. I just say, I don't know that we are there yet fully. We're maybe to the middle from where we started, and maybe at the next iteration, maybe we get even closer to staff recommendation. I know McHenry County, they do full staff reviews and staff recommendations on their grants. Even from whatever perspective, you know, I'll just put it out there, be transparent, even from a political perspective, that would concern me with where we are at in the community right now, frankly speaking. But I'll just say, we are a resource to answer any questions you have, and I do apologize if that takes more time for you, if it's not as right there in front of you as you would like it to be. But if you have questions about, hey, I wasn't on this site visit, can you just give me a summary of what your experience was on that? We're happy to provide all of that, and certainly do everything we can to provide that up front. But some of it, you might just have to call us and ask us if it's not readily available for you. And what we have always done, we can continue to do, is I think we've always had a meeting, whether it's with each individual doing the reviews, or I think last year we got to the point where it was just with Dick and Mary Ann, and we went over kind of a full package together. And because then you start to kind of play with the levers a little bit, because you got to get to a certain number. And so we kind of look at that full overview of.
And it's looking at the total boards.
Yeah,
Scoring
what did
of each grant.
What did every board member think? What was their pushback? Where were the areas where they had concerns? How could those concerns maybe be mitigated through special conditions? So happy to play all of those roles in it. So maybe like just shy of staff recommendation, which I don't know if that's what you're asking for, but.
No, well, ultimately, maybe we'll get there with the volume.
Yeah.
But I understand completely what you're saying, and I agree. I'm wondering, so I'll just throw one other thing out there, challenging getting to the middle ground. I can remember last year calling Nicole about something, and my recollection was it was percent of budget utilization at some, and, or at least either that or was administrative cost built in. Anyway, and it didn't make sense to me, and I called her and she said, yeah, you know, you're right that doesn't quite add up. But I almost consider it lucky that I fell into that, rather than it came with a broad knowledge of the expectation across all programmatic lines, what that might be. So I guess what I'm leading up to is, would we, in somewhere in that middle ground, would we ever get to the point where it would be okay without opinion or recommendation if the staff would flag something almost as a red flag, whereas an asterisk to say, this may deserve more of your scrutiny, this particular area. You're not giving an opinion, you're directing our attention to something more. So I just throw it out there because I'm speaking for myself, I'm probably not adept enough to pick up on some of these things that some of the rest of you are.
Well, I think it's just very helpful to know if they have complied with
That's the issue.
critical areas that we are scoring. You know, do they have their compliance plan? Do they have a consumer feedback loop? Do they have, you know, those are the things that are time consuming to go back, because you have to bring up the documents
Exactly.
continuously.
Yeah, and yes, say, Nicole, you had us on site visits last year, which I'm assuming we're gonna be doing
Yep.
more of them.
Yep.
Maybe, and Bill, I'm kind of on the same wave as you are on this. If we had the proposal in our hands, when we walk in, so that we're looking at, oh yeah, this is what they asked for, this is what they wanted. Because sometimes I walk in and think, okay, do you remember this one? Yeah, I remember reading it, but, If we had some sort of documentation that this is what they were asking for, so this money we gave them, this is what they're doing with it, or that, what their program is, then that way we can ask a little bit more relevant questions. Just to make sure that we're focusing on what they're doing.
Are we requiring them to submit a compliance independent audit?
So I'd save that question for the third discussion item, because we're gonna talk about contract requirement updates. And one of those elements could be more strict.
That will tell us exactly what they are doing and help us evaluate the current application. But that will be independent. And it is required everywhere. In SAMHSA grants,
Right,
they require some compliance audit.
Oh,
For that, they give money.
I see what you're asking, Mohammed. We do have
Yeah.
a space for that in the applications, that either it's your most recent independent audit, or for organizations that maybe aren't at a size where they do that, but they have we do have some small nonprofits that maybe don't do independent audits, so it'd be most equivalent type documentation to that, whether it's an annual
Because
report.
if we are giving $1 million, we
Right.
need to know
right,
what is going on.
right.
We can just, believe in honor system. You're saying you did
No,
it
can't be
okay.
a no, actually, they include their audit.
It doesn't work there.
So I want to go back to what Dr. Gorski was saying, because, when managers say, you should never be surprised if you're getting fired because there's been so many moments before. I'll just say, when we as staff have concerns about programs, we're not waiting to do reviews and then bringing them to the board's attention. We're addressing them in real time, either with the organization or directly, or and Mary Ann, I think, can attest to the numerous things we've brought to her attention to say, we have a direct concern about this, that needs to be mitigated and recourse immediately. So I wouldn't say that there's something huge out there that we would feel the need to bring to your attention necessarily, but maybe as we're developing those packets, if there are a red flag issue, then it could just be something that's highlighted in that summary packet
Because,
of here was something that happened over the course of last year, we'd
Like
just
a-
like to make you
Like
aware
a
of.
compliance section, for example,
Yeah.
so.
Yeah, I appreciate you saying that, because it's not an implied recommendation, but it's an implied, the key boxes have been checked. And if there was an issue, we reviewed it with the chair and it's been mitigated somehow or other. I assume, let me just take it one step further, I assume if there was some really critical thing that wasn't mitigated, maybe we wouldn't be seeing it.
right, for approval.
Yeah.
Yeah,
Is that a fair assumption or no?
If there were a concern and it hadn't been course corrected, that you're saying, would you be seeing that when you do the review?
Correct.
And you're talking about checklist.
Yeah.
I'm talking about anything that the staff sees that they might bring to Mary Ann to say, we have a real concern about this, but we're working to mitigate it, and it doesn't get mitigated, would we then see it anyway? No matter
I
what
think,
element.
yes, like if we made recommendations to an organization and they, let's say, this has never happened, but if say
Right, let's just say,
they
Right.
refuse to mitigate it based on Mary Ann's recommendations, then I think it would come to the board maybe for a discussion on a contract, I don't know.
Yeah, because I think, and maybe this does go to what our conversation today is, because then the other thing is from our learning each year, what is our actual leverage in dealing with that? And it's, what is the contract language state that allows, so some of that, I've got stuff that I want to bring to the discussion today, say from the last year of learning. There's a couple of issues I do want to discuss in terms of should we formalize this in the contract language? And then that becomes a lever of, this was something that concerned us, we tried working through it. But moving forward, it just needs to be a hard line in the sand.
But we can absolutely add a compliance segment on there for you.
In summaries.
Yeah, in the summer, yeah,
Yeah.
sorry, yeah.
well, this is off topic, and I apologize, I just thought of it, Nicole.
No.
With site visits, you and I talked about this when we went on, and I would really like to encourage when we go on a site visit, we want to learn about the entire entity, but I still would like, immediately when we sit down with them, they say, thank you, whatever, but this is how much money we received in a grant from the mental health board, this is exactly how we use it.
Yes, and I think from what I'm hearing from Terry as well, I wrote down to have kind of a one pager. So how many people are funded by this program, how many individuals are served, what are your target populations, kind of, so when you're going in, you also know what questions to ask,
Yeah.
and then you have better information, so
So the two
I wrote down,
kinda go together.
yeah, yep.
Super,
That would be very
appreciate that.
I'm processing a lot of information. So in answer to your question, yes, if we felt that the program was in violation of its scope of work, of ethical standards, of of evidence-based practice, and we dealt with that issue and we brought that to Mary Ann's awareness and she made a suggestion and that did not help mitigate it, and it would absolutely be brought to the board. And what I will say, and it's not, our community partners really are trying to make it work. So we haven't had obstinance where anybody has ever been like, hey, you know what? We got the money and this is our program and,
See you later.
you know,
Have a
you
nice day.
come back next year, not our problem. We don't really care what you
Yeah,
think.
yeah.
You know, maybe it's because we have annual decisions and that's a nice lever and, or whatever it is. We haven't had that issue yet. I'm not saying we never would, but when we come back to people and we say, hey, even if it's we have a concern about this, I've never had once where any of the agencies have said, well, our contract doesn't say we have to do that. No, never has anyone said that. It's always when our concerns are addressed, even if it's not explicitly stated in the contract, there's always been an openness to how do we get it right.
And I think we use a lot of amendments for things that are not correctable right away, but they're working, it's a new plan, new focus, and the board automatically has to approve that. So, I can't even recall a time that things haven't been mitigated with that.
Yeah, and if people have their monthly reports, let's say the due date falls on a Saturday or Sunday, or falls on a Sunday, people make sure that they submit it on a Friday, so they're not even a day late, like people try to go above and beyond of, meeting all of your expectations.
Okay, that was a good discussion. Any further comments or?
So yeah, if you can, just either call me or email me or Jason if you think of your availability and you can let me know, or let one of us know, we appreciate it.
Yeah, January, February, and March. We need volunteers
The right months
for
to be
each
reading
of
all
those
things.
periods.
Yeah.
It's cold, it's dark,
Thank
already.
And accelerator funds, you don't have a choice, you will
Yeah.
go right to those.
I understand. The first one to step up.
Yeah,
You
Mary
may
Ann,
get-
look,
you may
Mary
get
Ann
them all.
did it,
Yeah.
yeah.
We're gonna be gone.
That's fine.
Yeah, so much fun those things are to read.
Okay,
Okay.
moving on to our second, discussion item.
Question.
Oh, Tim, I want to
I was
welcome Tim, neighbors, he's
I was
present.
just gonna ask, can I get a copy of that slide so I know the exact dates?
Yeah,
Yes.
yes, I can send them to you, I will email all the dates to everybody.
Thank you.
And then we're gonna start calling.
I will call you, you know I'll call you, you know I will text you, I will find you.
Okay. Moving on to our second discussion item, the City County Behavioral Health Advisory Committee. We've discussed this before, but I want to bring it back to the total board and get your input. The mayor, as you know, has a behavioral health committee, and they have been meeting for, I don't know, Jason's on the committee, so representing the board. So how long have you been meeting?
Since late summer, I believe, is probably when it started, and it's scheduled for every 2 weeks, and I think, it's been probably more like once a month. There's been a few in-between meetings that get canceled.
Right. So I didn't receive, Dr. Gorski received a call from, it's Travis Anderson, and he is the CEO at Swedish American. And what he wanted to do is to meet with Bill and I and Jason. And discussing that, we felt very uncomfortable in the beginning because he was a member of the committee, and we wanted to know if his committee realized that he was going to be meeting, and he was very respectful of that and went back, and we wanted to make sure the mayor and the chairman were aware of what Mr. Anderson wanted to do. And he went back and verified with the mayor, first of all, and then we had another call and request to meet. And we really felt that there are many stakeholders on this committee that we fund, and we found it really essential that we knew that all our stakeholders were informed that this meeting was going to happen if it was. And so, again, he took it back to the committee, and now everyone has been informed on that committee, the chairman and the mayor, and everyone is in agreement that there will be select people that would meet, and they have requested to meet with Dr. Gorski, myself, and Jason. And basically, I think that the reason that in Dick being the vice president, I talked to Dick about this, but I think Mr. Anderson being the CEO felt, comfortable reaching out to Dr. Gorski as the past CEO of the same health system. So that's how this all transpired up to this point. But I felt it's imperative that I get feedback from the total board as to how you feel about us meeting. Our job is not to, is to listen to what they would like to inform us of, what they're, planning to date. Also, how they see they could have a connection with our board, and it could be an advisory kind of committee or whatever. So I'm opening it up for discussion and questions. And Dr. Gorski can add, because he really had the primary discussions with Mr. Anderson.
Well, maybe just a little, go ahead.
No, I was gonna say, go ahead, finish your point.
Okay.
I have my question.
I think Mary Ann just said it perfectly, and I want to commend her. I had a number of conversations with Travis Anderson over the last, I would say, 2 months, and commend Mary Ann for her being true to transparency. So it was very clear at the beginning that committee that is on the slide there, the entire committee, particularly as Mary Ann said, the chairman and the mayor are the people who form this committee. And she was adamant from the beginning, they need to know for sure, let alone your entire committee. And she also, conversations with me, which I carried to him, is that you all need to know about the request. The committee, just to refresh everyone's memory, is comprised of all 3 health system representatives, Dean of the School of Medicine, Crusader, Rosecrans, Health Department, a variety of community stakeholders. And Jason has been there, I think you've been to every single meeting.
Sure.
And as represented as well. So I don't know that the committee has made a lot of progress. That may be part of the genesis for requesting a meeting. So that, maybe I'll stop there, and I know Mary Ann wants all of your feedback and questions of us.
My first question would be, what is their motivation behind this? Is it because we have a purse of 20 million and they want a piece of it? We dole out large denominations to several organizations that they're involved with.
Right.
So what would be their motivation to be almost an advisory board to us? I think we have a good makeup of what we have already. We're our own good advisors. Let alone, I don't have a problem with outside, influences saying, maybe you might want to look at it this way, fine. Good focus of something else is fine with me. But what is the motivation? Is it the money? That would be my first thing when we start entertaining this.
Well, all I can tell you is I don't really know yet their motivation. And I do agree with Dr. Gorski that they have not reached finality, like, I don't know if we asked the committee exactly what, you know, they are going to recommend, that they have decided on that yet. I think they want discussion. I think obviously the money is a factor. I can't deny that. I mean, we control the, you know, the distribution of the funds. And so, and we have offered, and I think, Jason, you've made it very clear to the committee that our job is to evaluate proposals, not to help any entity plan. That is not our position at all. We don't have side conversations. We're very transparent because we have avoided that from the beginning. We can account for every red cent in our line. And, you know, that's been part of the, you know, it's been in the paper that we have reserves, and that's been, you know, part of the criticism, but it's what we promise the voters to, Bill.
If I could add to that, because Marianne, in our conversation, Jason, Marianne and I have spoken about this a number of times, that has been stressed back to Mr. Anderson, that if such a meeting took place, we cannot be a party to any discussion of any specific proposal relating to the money. If such a discussion took place, it would be more, what are they seeing, what is their vision for how they see us moving forward? As Marianne said, is there some connectivity between them and us? I can only say that and I think, you know, Marianne's right, because I lived in Travis Anderson's world for a number of years. He feels comfortable sharing some of this with me, and he has this is at the 100,000 foot level, which I fully don't understand either, some conception of a community-wide service line around mental health. So this would be the way a health system person would think about it in terms of service lines. So he would see it, not just a health system has a service line, each health system in town has service lines, or cancer, or cardiac. He sees a community-wide service line around mental health. We're not sure, and Jason's there and has done a great job representing us, we're still not 100% sure they really truly understand everything our group has done. We're I would say fairly certain that the entire group doesn't, although many of them are recipients, we're not 100% sure. They do know that the inpatient side of mental health is something we really haven't necessarily addressed or touched. So in his mind, he sees inpatient, outpatient, some sort of global service line that brings some interaction with what they see and some interaction with what we've done and can do together. So that's my understanding as we've talked about.
Right.
Maybe where they're.
Right, but the discussion that if we have this meeting, we will not be making any decisions. We will be collecting information purely. And given that this committee was formed by the mayor and the chairman, that we feel that it's appropriate to at least hear them out and listen to them. But by no means does this indicate on any level that our strategic plan and our vision and our mission and our proposals that we have been funding for 3 years will disappear.
I'd like to hear what they have to say. It's not that I'm opposed. I just want to know in concrete words exactly what they're behind for this.
So what we.
See, I think we have to share, our model again, okay? So we use the community support system. We have 11 services that we prioritize, that we say, research has already shown these things need to be in the community to provide support to serious mentally ill adults and serious emotionally disturbed kids. So we started out doing, our priority was to immediately try to manage crises and to make openers in terms of expanding treatment, outpatient treatment for people within it. So we haven't done the thing of looking at going from the least restrictive to the most restrictive, which is hospitalization. So there's spaces in there of things that we don't have in the way that we would like. So there's plenty of room for discussion. It's the issue but the issue is, at least at least I would hope, that they're willing to accept our model. That, you know, to accept it as a very legitimate place to start to build a community system of mental health and addiction. So, if we could get there to begin with.
Well, Dick, can I speak to that? Because
Yeah.
I don't think that there was a deep understanding of
Yeah.
our model at the outset of this. And I did have the opportunity to present to the group on
Yeah.
that. And I think there is more of an understanding, maybe not full understanding, but there's more understanding of it. And I'll at least say there's not pushback on the model. There was a good acceptance of, okay, we're not, no one in the room is trying to say that we need a different conceptual
Yeah.
model or something.
Good.
I think where the question then became is, what is our role as the executives of the health systems in Winnebago County
Yeah.
and being part of the coordinating group? What can we do to support the coordination of services? Now, in that, could there be a potential path for, and because of that, we have a proposal for funding that brings funding here? I'm sure that different, you know, that's part of the job, right? Is to think strategically about how does my organization participate in that? How do I get funding for that? But part of the conversation is, what do we do as the chief decision makers for these organizations that provide services to make sure that services are all functioning together like a whole?
Okay.
And so I think that is the part of the conversation, at least my understanding is part of what the conversation will be about, more so that than any specific funding proposals or requests, which have been communicated after our notice of funding decisions were approved. This is it. Train left the station. You know, figure out what your proposals are. We're not having an existential moment right now to figure out what the next round of funding looks like. The next round of funding's out. You know, work on proposals.
So we're looking at reducing silos. Is that what we're talking about?
Yeah.
Okay.
I mean, that is at least part of the conversation. I don't know if that's the only thing that they want to talk
I
about.
think
When's your next meeting?
I think,
I'm sorry.
well, just to say, I think it's worth mentioning that Travis Anderson himself spoke to the community support model. But to Jason's point, they're talking about the outer ring.
Yeah.
And to connect, to decrease silos and connect all the dots from here to here. And that's where he comes up with the health system analogy of a service line, which he has apparently had some experience in different markets, Milwaukee, which has done this on a community level. So he comes to it with some witnessing to that.
Yeah.
So I think Jason has nailed it. It's the outer ring.
And in those models, the health system highly invested in behavioral health. So that's not what occurs currently. So it would be advantageous for that to occur in our community.
So basically, we don't know what they want.
That's true. Mohammed, you nailed it.
Tim, did you have a question before?
Go ahead, Ed.
So if you were asking for feedback as it relates.
Yeah, I'm asking for whether or not you think we should meet.
So to answer that question directly, I think we should, since we don't know what he or they want. I was a little bit confused. Is he representing the?
Well, it's gonna be more than just Travis Anderson. It's going to be Dave Gomel.
Okay.
And also Sam Miller.
And Jennifer.
Oh, and Jennifer from the school system.
Jennifer Lawrence.
Lawrence, correct.
Why, well,
Do we, so when we meet with them, do we have any ask of them? And, you know, as a group, you know, since they want to meet, you know, we can also use them to our benefit to help, you know, we want a community web of networks that can help us weave that web in areas that we're not allowed to as a board. So if we could go to that meeting, we could ask them, you know, to help us with those areas. You know, like, you know, some of the programs that we're looking for, you know, we can't go out and search for them, but they can.
Right.
As an advisory board, they could go search for those companies that we need to come to this area.
If I may, that was the next question what I was sort of getting ready to get at in terms of, okay, we exist, and I hope I can say this correctly, but this board exists in part because some other systems and situations have not come together.
That's right, that's right.
Like you would expect them to, or like they have in other
Right,
municipalities. So
exactly.
given that reality, I think what Tim is getting at is kind of where I was getting ready to lean into, particularly since, I know this is anecdotal, but I have a young man who is, from my congregation, who just finished up medical school, has come back to Illinois, wants to be in Illinois, wants to be in Rockford, but he wants to do a psych residency and we don't have one.
Right, exactly.
I talked to him last night and I told him I'd bring it up in this meeting. So if they want to talk about stuff like that, since, I mean, the health system's together, and I was gonna ask, and I could bring it up here, because a few meetings ago, Dr. Signaro Green was
Right, I was
here.
gonna say,
and
that's
we
exactly
We
what
sort of
was
asked him
referred
about
to.
that. I'm like,
Yeah.
okay, well, let's talk to the ones that got the money. They wanna meet, let's meet about the issue that really is hampering us in terms of putting together all that we want to do, and that is creating the pipelines that we need in the residency
Yeah.
and the workforce development that needs to occur, that
Absolutely.
is going to benefit not only you, but the whole community.
So oh, go ahead, Mohammed.
Why are we hesitant to meet them?
Pardon me?
Why are we hesitant to meet them?
Is it hesitant?
No.
Oh,
It's not hesitancy.
it's not hesitancy.
It's
the transparency.
I mean, we want the board to be very knowledgeable about what is going on.
We don't want to
and-
decide meetings.
Yes.
The
Yeah,
impression of that.
I also think if I could just reiterate, and Jason began to allude to the environment that we're operating in right now and the trajectory of our approval of the referendum again and everything. I think if you look at this committee and who's on it, who appointed the people to it, I don't think it would look good for us to not be with them. And I think Tim raises a great point about what can we ask of them. For me, if it happens and we move forward and I'm there, I just want to hear them, those representatives, say exactly what is it there and listen and bring that back to all of you. And I'm sure I speak for the two of you, we would certainly make no decision, we would do nothing without all of you knowing about it. This would be a listening, primarily a listening and us questioning, you know, how do you see this happening? And, but I still need more clarity.
well, I think we all need more clarity, and it's hard by just having the smaller group from our board, it doesn't become a public meeting. And I think when you are just trying to discover a lot of what we're even talking about, it's so much easier to conduct questions when it's not an open meeting. Go ahead, Tim.
And then with that being said, as we get to, you know, after your meeting and we figure out what they want, and then if it aligns with what we want, they're willing to work with us, I think we should have a joint meeting, like
Right,
a retreat, kind of like, you know, so we can help them figure out what they want to do as a board and how they can help us. And, you know, because I see benefits on both sides, you know, because
sure,
they can reach areas that we're not allowed to reach, and it'll be great for them if they're willing to work with us on that side. And that'll be, you know, just to be able to have a retreat so we can hash all those questions out and meet, you know.
if we all meet, it's an open meeting.
You can still have a retreat.
I don't,
Yeah, it's fine.
okay, any, no, we do not, this is only a discussion item. So, I think that, you know, we will pursue the meeting, so, okay. Moving on to our last discussion item is the program years 4 to 6 funding agreements. And Jason, that would be,
Okay, so this is the part where it kind of, started a little bit in our conversation of reviews, because each year, as we're looking at, sometimes you have issues that are isolated to one program and we kind of just deal with that. And then sometimes there's things that it pops up in several places and you think, okay, well, this might be a more global issue. This might be something we haven't articulated clearly, maybe something we need to look at as part of our contracts moving forward. And some things are just more structural nature of, as we evolve, move to multi-year funding, there's going to be different levers we want in our contracts. We don't have that same sense of authority or leverage with a, hey, you're gonna have to reapply in about 9 months, so should pay attention to what we're asking. So, and then some of these just came from board conversations recently, such as residency requirements, okay? I'm not gonna necessarily go into the weeds on each one right now, but I wanna get your feedback on if I should get into the weeds on these issues, okay? And then what I generally do is I'll oftentimes start off with the ACMI network, which is many established mental health boards and some emerging new ones as well. And I ask them, what is your policy on this? I've already done that with residency requirements. I've already done that with emergency funding. So I already know what other mental health boards are doing in those 2 areas. Some of these other areas, I haven't gone down that road yet. I may do that and then coordinate with legal counsel on updated contract language that we need to approve before we get into the new contracts for the upcoming awards, okay? So I'll start off with residency requirements. I went back and looked at our process. What we currently do is we have it in our applications. One of the questions in our applications, how are you going to approach making sure that this is for Winnebago County residents? And then we have it in our contract, not as a specific way of defining residency, but just reestablishing that it's only for Winnebago County residents. So maybe not with specific language, but in practice, what we've essentially done is require each agency to have their own definition of residency and to self-manage that. So I think what the question would be is, do we want to have a standard definition of residency that is applied across all of the agencies? I think that's difficult to do in practice, but I'm not opposed to it if we want to go down that path, rather than the alternative being having a somewhat more decentralized approach where we really just require each agency to have a residency framework without necessarily we're making the definition that everyone has to apply. And there is truly no one standard definition of residency, even from a legal practice. Like I worked in Social Security disability for years, and they had their own definition, which might be different from a different government definition. You go to the DMV and it's, do you have 2 pieces of mail with your, that's residency, that is establishing residency. So different agencies already have different definitions, which is where the complexity lies in that. So any feedback on residency?
well, I do take it back to the campaign for the sales tax. And that was important to the voters, that there was some residency requirement that we would not be allowing programs to serve Stevenson County because they have their own mental health funding there. A 708 board, as I understand it. If you feel that the way we have it set up now, and do we monitor it enough, that you're confident that, who we're funding is really paying attention to this. I don't know that we'd have to go further, but I really want to make sure we continue to do at least the requirements.
I think the next level of compliance monitoring would be doing case file audits. That's the only way you're gonna get to the next level of beyond what you're telling me.
Right, and, you know, you're right about residency. I mean, anybody that's in a psychiatric crisis in Winnebago County, they're gonna be serviced at the local hospital, you know, so even for our crisis intervention programs, I mean, it would be hard to just have a really stepped up.
In our monthly reporting, just as a reminder for the quarterly outcomes that they report 3 months at a time, it has zip codes of where individuals reside, so people are tracking and some programs do serve people that are not Winnebago County, but they do not include those, so they do track it, we do have numbers served by zip code, so there is a mechanism for reporting that you receive, from organizations, so.
Okay,
Well, I'll continue to look at what the other boards are doing. We will draft some language, so you'll have an opportunity to review before it is finalized. On the issue of emergency funding, this has only come up twice in the entire time that we have been funding organizations. The first time was RAMP had asked about it because their elevator broke and some of their programming was dependent on the elevator. And they ended up getting funding, I believe, through the community foundation. So it kind of ended up being a moot point in which they were able to get that addressed. The second time it came up was with OSF trauma recovery, in which they came and presented to you all. It's been several weeks since I've talked to the clinical director for that program. I know I was my understanding they were gonna have funding probably to get them through the end of the year. And then they were talking with OSF about whether OSF was gonna allow them to go until they could reapply for our 3-year grants, core program grants. In that conversation, I've explored what other mental health boards do with emergency funding. Some do have some type of contingent emergency funding, not for their entire community, but for their funded programs that if something comes up that's completely unexpected, that would otherwise keep their program from being able to continue to operate, that they've got some small fund available to access with a request to do that. And talking to legal counsel with this, they're always cautious about reacting to one situation and creating a policy
Right.
for one organization. So, if we were to move forward with this, I think potentially the best way to address it would be to actually work it into the next round of contracts as some language that if a situation occurs in which, a budget amendment is not sufficient for dealing with it and otherwise it would stop your program from being able to move forward and there is no additional funding that you can access. But then to also have a threshold on that where it's not more than like 10% of the total program budget that could be requested. Because you wouldn't want a situation where even if you had a contingent emergency fund, that one program, just because their emergency happened the soonest or the earliest,
Yeah.
they take all of it
yeah,
and it's not available for the next emergency. Again, it hasn't been something that has been an issue, right? I mean, we have, aside from a rare occurrence, so I don't know if it's worth taking it to that formality or not.
If we did that, Jason, would we need a budget line item for that?
that's what I was thinking.
So that would be
Informal?
probably the recommendation to then also establish a contingent emergency fund line item in the budget that holds just enough to account for 10%, let's say, of that core program funding in that year.
I think that's reasonable.
So what you just said, the last thing is, in each budget, of each funded program, there will be a contingency or an overall budget of ours to use for,
No, it would be an overall budget line item for the board, and then it would have to be a request from the program to access that, but you just put a cap on it. no more than 10% of your yearly budget could be requested. So if you're getting $100,000, you can't request more than $10,000 that year for emergency funding.
Really getting into the weeds here, but I don't think we have a line item that would be 10% of the total of all the funded programs. That would be a big line item.
That'd be
$2 million a year
Yeah,
Yeah.
that you have to maintain in a contingent.
Yeah, well, that's in the weeds, but I mean, because at some point, if it's less than that, and it happened numerous times, it'd be first come, first served until it's exhausted.
right.
How other mental boards are known for this kind of funding.
Yeah, that's kind of what others have done is they might have a line item in their budget that holds a certain percentage of their total funding for contingent emergencies. And then they just have a form or a series of questions that you'd have to answer to request that. And then it would have to come to the board for a decision to get that. And the way to avoid it being first come, first serve is to put a cap on each. So you have a budget line item, but each program is capped from requesting more than their.
Yeah, right.
I got that.
That makes sense.
It'll probably encourage some agencies to be more creative in finding some emergencies. But that's part of the work, right? If you have any type of funding opportunity,
human nature.
people will find ways to request it. So is there any pushback on not going down that path? I mean,
But it also depends on the nature of the buildings. Yeah, if the building collapses. So what do you do? When you move the program? So how severe the problem is?
I think that comes down to how much money does it cost to fix it.
Right.
But then you have to then relook at
Yeah.
program.
Do you think we should have something like that? Okay. Renewal and compliance. So, I don't have as much specific to say about this, but I think if we move towards multi-year awards, we probably need to have maybe this comes back to that conversation on when it gets past red flag that we've tried to mitigate and it doesn't, what does it look like to stop funding
Right.
for a program?
Policy around it.
And I don't think we have specific drawn out steps for that in our
I agree.
contract.
I
think
agree.
Giving a 3-year contract without having some of that language could be a risk on the board's part. So I probably would look to draft some based on less modeled language. Deadline for processing payment requests and underpayments and overpayments. While it's very rare, new programs coming on occasionally, maybe 9 months, 12 months after program year 1 has ended, say, hey, we didn't, found this big receipt here, or purchased a van and didn't request reimbursement for that. We've tried to, in good faith, we're trying to spend the money, right? So we haven't put any artificial stops on when the deadline is, but I think probably should, especially for doomsday forecasts where the tax doesn't get renewed and you don't have money, but then people are submitting receipts. Who's liable for that? So I'm thinking maybe 12 months, or we could explore, but something like 12 months after the end of the contract date, it's closed. There's no submission. 6 months maybe after the contract date, and on both sides. If we catch an overpayment after that period of time, it's absorbed by us, and if they have an underpayment after that time, it's absorbed by them. Yes.
So what do you mean by contract date?
So program year ends
So it's
May
after 6 months
31st.
after the program year ends.
6 months after that date, no more submissions. Doesn't matter if you miss something, doesn't matter if we find something after that, kind of a mutual clause of, let's have a cutoff.
Even if they're a renewal? So you talk about 18 months would be the clock is ticking for 18 months, even if you're a renewal, we moved into the next year, you gotta submit within that timeframe.
That's a good question. So if you have a 1-year contract that can be renewed, is there a cutoff for year 1? You know, I think it could still be reasonable to do that, just for even from a budgeting standpoint.
Yeah,
I was
that's-
gonna say, just for accounting purposes.
That's, yeah,
That's why I asked what you mean by, contract date. Do we want to do contract date or, the end of the fiscal year?
So, okay, good question. As it stands, the fiscal year for the county, usually anything that gets processed after this year's January 8th is not gonna go on the last fiscal year budget. So in that period of time from October to basically the end of December, we strongly prioritize getting everything processed from the last fiscal year so that there's a more true accounting to what we actually spent in that year. So we're kind of doing that, but I don't know for what you put in the cutoff for the contract, we could do it based on a fiscal year date, or we could do it based on that's a good question. Do we have, at the end of a fiscal year, you must within 3 months process everything from the past fiscal year? That would keep the fiscal year accounting a little more true, certainly.
that makes the most sense.
Based on the county fiscal year date.
But it's, will our fiscal year remain, the same going forward, even though we won't need to,
You can, I don't know what, I can't think of any reason why it would be beneficial for the board to establish a different fiscal year from the county, but you have the authority to if you want.
yeah.
Yeah, so we could probably put some language in for processing payments at the end of a fiscal year and then at the end of a contract year, maybe have both of those addressed. It's good. Good thought.
Maybe not, I think, trying to get the dates straight in my head. With something like, you know, from the time of award, depending on how you count the time, that you have 18 months. I'm just trying to think of a time frame that's something more than 12 months, understanding there'll be something that will roll into the next year that's reflected on the previous year, however we're counting it award, that it's okay to submit that. But if it gets beyond a certain time, you've timed out. That's trying to make it simple for my own head. I'm
Yeah.
thinking 18 months seems reasonable, however we choose to start it and stop it.
So you're saying start the clock from the start date and have a certain amount of time from then versus starting the clock at the end of the contract. So how much time you have left. Okay.
Yeah. Well, it's just another way.
There's a few options. Let me look at that. Maybe I'll see what other contract language is out there and see if there's any pros or cons to doing it based on a start date or end date.
From my perspective, whatever's gonna be cleanest in terms of not only accounting, but if ever there need to be audits on either
Yeah,
end.
that's.
Yeah. Okay, thank you. Good feedback. We'll look into that. Okay, board member payments. So this is one of those that, there have been a couple of occurrences where a program has had somebody that's been a nonprofit, has a nonprofit board, and their board member becomes a contractor to the agency for some of the services they're doing. And we don't really have anything that says that can't be done, but I think maybe have some concerns about if that is a best practice in nonprofit management. And just kind of curious, you know, a lot of experience in this room, is that something that we should be concerned about as we have asked in those situations for that nonprofit to provide us their policy. And they've done that, but even with, you know, a board having a policy, is that a red flag for us that we'd be concerned about? If you're on a nonprofit board and you're making decisions with that board, can you all, you know, in a situation where you're also then getting money, you know, from the board, is that an issue?
I never knew that happened. Is it legal?
That's what I was gonna ask. It seems like there's some kind of,
They're paying boards.
Doesn't
Doesn't sound like best
practice.
But for someone of a nonprofit board, have their board members being paid for
They're an
service.
employee and a board member at the same time.
Oh, okay.
No.
Have you consulted our attorney
Yeah,
on
that's
this one?
what I was wondering.
I haven't.
I would
you-
love to hear
Yeah.
what they have to say about this.
You know,
That'd be interesting.
this is, you know, the organization that I worked at for many years had a very large board. There's so many bankers on the board. It would have been impossible for Swedish American to do banking without it being the institution of one of those bankers. Now, that's not been completely analogous. Where my mind went with this is we're a public board with public money.
Right?
I think that's a little, to me, that's a little bit of a different filter than like, yeah, the whole system is theoretically gonna be profitable. It's a far different model than the monies that we're receiving. I agree with Mary Ann. I'd love to know what our attorneys think about that.
Okay, we'll explore that one as well.
Okay.
Evidence of expenditure requirements. I think we have some feedback coming from my director of finance, who has gotten a little more involved with the process to add a couple of additional things on what type of evidence we get submitted, to standardize just a few things. We have always operated on the principle of best evidence, meaning, you know, you've made an expense. Sometimes you have an invoice, sometimes you have a receipt, sometimes maybe it's an internal transfer. You've got large systems. You know, we had one that was like a university system. It was like, well, we had a transaction that was from our internal printing shop to here. So it's just an accounting thing. How do we document that? Get an email or something, right, to document it. So we've got a couple of things we would just want to add to that, and we'll probably just maybe putting that on your radar, that there'll be additional language then added to the contract that we'll recommend for a few areas where we think there should be a very clear standard beyond just principle. I'll open that up though as well, if board members have anything that you would have of specific concern as we move forward in this area. Okay, the last one's kind of a big one, but as we move into accelerator and we potentially have some capital projects, I don't want to maybe have to project manage those. You know, every time that screws get purchased or whatever,
Yeah,
so.
right.
Actually, we've consulted with legal on this, and they've suggested and provided a copy of an escrow-based contract where for a capital project or construction project, we could work with the agency to give them a lump sum payment that goes into an escrow account, and then that gets managed by whatever bank that they can release the funds at certain thresholds. So I think that would be a good route to go potentially with capital projects, especially if we get a few big ones out of these accelerator awards. Just wanted to make sure before I invest too much time in that.
You want to track that?
No, it doesn't. No, I think
Will that go on on our contracts, so we don't review all of that?
Yeah. We get the review.
That's
right.
I love reading.
We won't restrict you from doing site visits, Terry. I know you want to get the hard hat on and
Yeah.
go drive the bulldozer.
Kind of like I'll be doing YMCA. the hard half.
So how do we do with the park district with the equine center?
Well, in that situation, we didn't have an escrow contract, so we have kind of had to check the receipts and do the releases, and it's been okay, it's been fine, we haven't had issue, but, you know, if we get a few of them going at the same time.
Yeah.
Yeah, I'm done with that. Yeah.
Are they really?
but that wasn't really a capital expenditure for them.
The first year was, the
Yeah.
first time.
They would submit like their architect plans
Right.
and like they had
Oh,
very
my.
specific like construction.
I thought it was
plans.
just, just a programming.
Yeah, and then Stepping Stones was the other one,
Yeah.
and same deal, we went through all of it, it's fine, but I think it's just easier on everybody's part if there's another mechanism for it that can be,
That's good.
that we contractually feel comfortable with, but we're not having to do the day-to-day management.
Right,
All right, we'll move forward with that as well.
okay.
That's it for me, thank you. Appreciate it.
That was great.
Yeah,
Thank you.
for your attention.
Yes.
on-
Yeah.
Wow,
That was a long time.
Yeah,
wow.
good,
Yeah.
good piece.
Okay, moving on to other matters. At this time, I have none. Tim has his hand up.
I've been approached by, Dorothy Red, it's small, but she wanted the mental health board to put an ad in the NWCP banquet booklet. It's $200 ad. I just wanted to know how we approach that, and I don't see how banquet is this weekend, so. So she's still asking for ads to put in that booklet, and I also thought that, it'd be a good, way to get the word out about the mental health board. So I didn't know how to approach that, how we would go about that.
Yeah, so we had originally tried to put money in for more promotion and awareness this year. Because the budget wasn't approved in its entirety, we reduced that part of the budget so we could pick that back up in January. And then what I was hoping to do in January was add that back to the budget and then to maybe create some protocol for what would be the types of things we want to go out or pay for, because I think we've not yet done it. And I think the moment we do it, we're gonna get a lot of requests for it. I think the priority from my perspective is the things we can get out to and get a booth and share information at, because that's distributing the information. If the board wants to go beyond that and do ads at various things, I think we can support that, but we might want to have a frame of reference for how we filter through that, because we'll have to do that actual purchasing and probably do the purchasing through Region 1 and then get reimbursed for it on the purchasing side. So that would be my preference. And I think in this situation, it would be hard probably, unfortunately, I'd love to do it, but I think it would be difficult for the turnaround time, but then also, even though it's a small expense, we kind of temporarily reduced that fund. And I was hoping to pick it back up in January when the board had the ability to readjust the budget. So that's my feedback on it, but certainly open to any board direction on that.
Sounds like an appropriate venue to have something, but I think your point is we haven't done it yet in that way, and probably would open the floodgates up, I suppose, if we had that type of presence in a variety. I mean, I can imagine a lot of organizations would want us to purchase space and brochures and things, right? I mean, are you thinking that would happen?
We have over the years gotten not a ton of requests, but we've gotten requests, and I've just always said we don't have a budget line item for that, which has been true. We haven't had a budget line item that's been for that type of, community event marketing or promotion, or a lot of times it's sponsorship.
Yeah.
Sometimes it gets called sponsorship, but it's like you're getting a booth at an event, right? And you're going to an expo, and those are opportunities to get out in the community and give information to a network that we might not otherwise access. So I feel there's a good opportunity there for those types of events, but then maybe we want to differentiate that from what type of sponsorship we maybe wouldn't do. I don't know, is purchasing a table at a banquet the same thing as getting a booth to pass out? Those are sometimes maybe called the same thing, sponsorship for an event, but functionally they're very different and what we're having the opportunity to do. So, sorry, not to try to overcomplicate it, but as it stands, we don't have a budget line item for it.
So that answers the question.
The nicer way to say no.
It took a while.
But we would like to do it in June.
Along that line, I have tickets for the freedom planning.
Okay. All right, so,
I moved to the.
okay, we need a motion for adjournment. All those in favor?
Yes, right. Have a Merry Christmas, everyone.
Well, to all of you. And then